Hi friends, this is a friendly reminder that yoga is back at the Functional Medicine Center. We were meeting on Sunday mornings every week and attendance was very low, especially during the heat. So what we're doing now is a monthly workshop and it'll be a 90-minute yoga class, but don't worry, we're not going to do yoga the entire 90 minutes. So this first one is great for all levels and it is our spine workshop. It's basically an introduction to yoga. We are going to start with the anatomy and the function of each part of the spine, and then common things that we do to injure our spine or cause chronic pain, and then how we can fix them and how we can make sure we prevent future injury. So there's going to be 4 different parts. We'll take breaks and we're going to move and do some yoga as well. However, we're not going to be doing yoga the entire time. So who is this workshop good for? It's really good for anyone who finds themselves waking up with nagging neck or lower back pain, or do you start the day feeling okay, but by the end of the day, is your lower back aching, is your neck aching? And again, we're going to talk about why it's happening and then how to fix it and what to do over the long term. Personally, I have had chronic neck injuries from sports. I also have had lower back injuries, SI joint, which is the sacroiliac joint. We're going to talk about what that is, why it's easy to injure it. I played field hockey in college, so I also have had something called piriformis syndrome. So I'm going to talk about what that is. And as many of you know, one of the #1 complaints we see in the family practice clinic is back pain. But I would say these days neck pain is just as big of a complaint. So we'll talk about the soft tissue, the muscles, the fascia, the discs that actually cushion the spine. We'll talk about what you can do about soft tissue injury or tightness. Dehydration of the fascia is a huge problem. How we can get rid of some of these chronic knots in the tissue, and we'll also talk about the structure, the vertebrae, and how they are aligned and how to keep them lined up even in between treatments with a provider such as a myofascial massage therapist or a regular massage therapist or a chiropractor or a physical therapist. Okay, and I'll do my best to also kind of give you an overview of when we should bring in those different people. But so it's basically my experience personally from playing sports, now sitting a lot in clinic, as well as my experience as a yoga teacher, what I've seen be the most common areas of tightness and injury as a yoga teacher, and my experience as a physician assistant, what I see in the clinic when people come in with pain. Let me know if you have questions. The link to sign up is below in the comments. Please click there and enter your email to sign up. Wednesday at 5 o'clock. See you there.